Hey everybody, this is Chris Franchina with Policy Engineer Insurance Solutions. I'm one of the co-founders here, and you are watching our Medicare 101. This is understanding your plan options for 2024. So Medicare can be a complex system. At any point, if you need to stop and take notes, feel free to hit pause. Now, speaking of insurance, we're going to look at the first option that we looked at earlier in the presentation, which is Medicare Supplement insurance. Medicare Supplement insurance, it can cover things like your deductibles. Depending on the plan you have, you may have no copay, and most importantly, it covers your co-insurance. It gives you freedom to choose from any Medicare-appointed doctor in the United States, and what makes these plans easy to shop for, they're all standardized based on their plan letter, which we're going to take a look at on the next page. And now the only difference between these plans would be the monthly premium. That's either based on your age or your zip code. All right, so now on this page, we're taking a look at the Medicare Supplement insurance chart directly out of your Medicare and U-Book. Now highlighted in yellow, you can see Plan G and Plan N. These are the most popular Medicare Supplement plans. And on the left-hand side, highlighted in gray, these are all the benefits that we've gone over earlier. Your Part A coinsurance, that's your hospital coverage. Part B coinsurance, that's your medical. Then blood work, your hospice care, skilled nursing facility care, Part A and Part B deductible, Part B excess charge, and if you're a traveler, foreign travel. Now let's look at the Plan G in more detail. As you can see on the screen, Plan G covers 100% of all of the benefits we covered earlier. The only box missing is the Part B deductible, and that is a one-time annual deductible in 2024 of $240. And now the Plan N is very similar. It covers 100% of the benefits that we went over earlier. Now there's two boxes missing. One would be that same Part B deductible, $240, and the Part B excess charge. And you might notice up on top, there are 3 stars under the copayment section. So with a Plan N, you may have up to a $20 copay for some office visits and up to a $50 copay for some emergency room visits. Now, as a reminder, Medicare Supplement insurance does not cover your prescription drugs, just designed to cover your medical. So with that, you have 2 options to cover your prescription drugs. All right, so the first option to cover your prescription drugs with Medicare would be a standalone prescription drug plan. And if you're getting a Medicare Supplement plan, chances are that's the plan you're going to choose, a standalone prescription drug plan. That is an insurance plan just designed to cover your medications, and you would take that insurance plan into the pharmacy and get your medications filled. The other option to cover your prescriptions would be using a Part C Medicare Advantage plan. Some of those plans, I should say most of those plans, are going to include prescription drug coverage integrated inside of the coverage. Now, to have Part D of Medicare, you must be enrolled into Parts A and or B of Medicare and live within your plan's servicing area. Now we've come to probably the most complex part of Medicare. So we're going to go through this slowly, and I'm going to cover each section you see on the screen right now individually so you walk away with complete understanding of how the system works. What you're looking at here is the Part D stages on Medicare. All right, so the first stage we're going to cover, this is your deductible stage. Now, the deductible for 2024 is $545. This deductible may or may not apply to you. It depends if your insurance plan has the deductible or the medications you take. Some medications are what's considered deductible exempt, and you don't have to pay into the deductible. Now, once you've met your deductible, if it even applies to you, then you're going into stage 2, which is initial coverage. The initial coverage stage, this is just your standard copay for your medications. Most insurance companies are going to have a tiered system. Tiers 1, sometimes up to tier 6 in some cases. Tiers 1 and 2 are going to be your preferred generic or generic medications, and tier 3 and above, those are going to be your brand name medications or high retail cost medications. Okay, so now stages 3 and 4, this is where it can be a little complex. So if you have a notepad handy, take some notes through this section. So stage 3, this is the coverage gap. It's also known as the donut hole. Unfortunately, it's not as sweet as it sounds. In order to go to stage 3, the coverage gap, the maximum of your payments and your insurance plan's payments on your covered drugs must exceed $5,030 in 2024. Then you go into the donut hole. And now during that stage in the donut hole, you'll pay 25% of the retail cost of your covered drugs. As an example, If the retail cost of your medication was $100, you'd pay $25. That's 25%. If it was a $1,000 retail cost, you'd pay $250. That's 25%. All right, now the last stage to the prescription drug coverage on Medicare. It is called catastrophic coverage, and now this is one of the biggest changes Medicare made in 2024. Now, in order to go from stage 3 into stage 4, the catastrophic coverage, your true out-of-pocket costs on your medications would need to exceed $8,000. Now, that is what the insurance companies and yourself pay for the medications together. Once that number exceeds $8,000, then you go into the coverage gap, and this was a big change they made in 2024. And once you reach stage 4, catastrophic coverage, your co-payments and co-insurance stop for the rest of the year. Now we've come to the section a lot of you have probably been waiting for, which is the Part C Medicare Advantage plans. The Part C Medicare Advantage plans are going to be a combination of your hospital coverage, which is Part A, your medical coverage, which is Part B, and in most cases will include prescription drug coverage, which is Part D of Medicare. Now, with the Part C Medicare Advantage plans, you're going to have a managed care network and hopefully an awesome medical group assigned to your insurance plan, and you'll have a primary care physician assigned to your insurance. If you have an HMO Medicare Advantage plan, you will need to get a referral to see a specialist or any doctor outside of your primary care physician. However, there are a lot of perks with having the Part C Medicare Advantage plans. All of those yellow tiles we looked at earlier in the presentation, things that original Medicare does not cover, well, you may have those integrated inside of the Medicare Advantage plan. So you want to look for those specific areas of coverage in your plan.